Hi there, this is Lori Edge-Hughes, and this is your foreleg rehab minute. And in today's minute, I want to talk about targeting the dura in your treatment of IVDD. Okay? So, first off, let's talk about anatomy. So, the dura in the dog is, well, of course, that surrounds the brain, the spinal cord. Okay? And it is known to have a bit of an attachment to the floor of C1, C2, okay, boop, boop, and also then all the way down to the second and third coccygeal vertebrae, okay, C1, C2, and then the beginning of the tail, coccygeal 2 and 3. Okay, so now you hold on to that bit of information. The next bit of information is where also does the meninges, does the dura attach to within, okay? So within the spinal canal, okay, it's also going to attach to the top, to the ligamentum flavum. It's going to attach down to the bottom at the posterior longitudinal ligament or the dorsal longitudinal ligament. Okay, then it will also attach to what's called the denticulate ligaments. Okay, and they're basically what is going around your sleeves to your nerve roots before they exit. That kind of helps to hold the whole spine in the middle in the spinal canal. Okay, so it's forming sleeves around the nerve roots before they go. Okay, good. And so those are your pieces. Now, why you care about that? So in the case of, let's say, intervertebral disc disease, you can have compression pressing onto the dura. That can create a mechanical irritation. And because of that mechanical irritation, you can get some inflammation and problems specific to that region. Okay? The dura also has, can signal pain and all of that in there as well. So if you have your little dog with IVDD and it might be too painful to actually, touch it at the exact spot where the lesion is, you have other mechanisms in which to treat or try and target inside, to target via the dura, to target that area. You can have a mechanical effect. So if I use my tail, which this guy doesn't have, if I use my tail and I can do tail traction, I can affect the dura, okay? And I can have an impact at that level, which may help reduce the mechanical inflammation. It might also help to stimulate, to create enough of a stimuli to increase blood flow or help with lymphatic drainage. Okay, and then likewise, so let's say we have something here in the cervical spine. Let's say I could just play around with C1, C2, and I don't mean, cranking them around. Oh, I'm stuck. I don't mean cranking them around. I mean just little movements, okay? My guys, okay, we gotta do a little one. There. So even if it's just little movements from side to side, I'm likely a better model for this. Little movements from side to side, right? I don't want to make this dog do big old movements. Little movements side to side, C1, C2. That might also then be able to, because of those attachments, impact cervical dura, maybe teeny tiny little itty bitty neck tractions. Go watch those videos. Itty bitty neck tractions. Okay, so that is it. I want you thinking out. My hair is terrible. Thinking outside the box in how can I target the tissues? What are ways I can target the tissues to have an impact inside the body? Okay, from my manual techniques outside the body. That's it. Until next time. Cheers.